Hello students, today we will discuss the development of the thyroid gland. It is the first gland that develops after fertilization. So it develops from two sources, the follicles from the thyroglossal duct and parafollicular cells, they come from ultimobranchial body. So with this lecture I would like to suggest you please go through the lecture of pharyngeal arches before studying this thyroid gland. So you will understand the ultimobranchial body, what is that, so from that lecture. So at around 12 weeks they start producing thyroid hormones. What are the stages of development? In the floor of primitive pharynx over first arch there is a swelling called as tuberculum impar. The pharyngeal epithelium or endoderm form a depression called as thyroglossal duct. Opening of the thyroglossal duct in the pharynx is called as foramen cecum. The thyroglossal duct grows downward in the midline. The tip of the duct bifurcates and give rise to two lobes of the gland, and the ultimobranchial body form parafollicular cells. So these are the 6 steps you should know in the stages of the development of the thyroid gland. So this is the diagram which is taken from your book. So you can see the site of foramen cecum. It is growing downward as thyroglossal duct. Then bifurcation is happening. So after this bifurcation is going to form the lobes of thyroid gland, and this ultimobranchial body is contributing to this lateral thyroid, which is coming from the 4th pouch when it fuses with the, you can say, the remnant with the 5th pouch. So that is ultimobranchial body. So what are the anomalies of thyroid gland? So in shape, if we see the anomaly in shape, the pyramidal lobe may be there. It may arise from the isthmus or any one of the lobe, arise from the thyroglossal duct. Isthmus may be absent. One of the gland may be absent or very small. So these are the anomalies or the diagram showing the various anomalies. This is the pyramidal lobe. Then isthmus may be absent. I will show you the next diagram. So one of the gland may be absent or very small. You can see here. So one half may be absent, isthmus may be absent, pyramidal lobe may appear. So these are the anomalies of the thyroid gland. Now if we see the anomaly in position, because it is starting from the foramen cecum is lying over here, so the thyroglossal duct is coming downward. So if it persists in the tongue only, we call it as lingual thyroid, which is lying under the mucosa of the dorsum of tongue. Then intralingual, embedded in the muscular substances. Then suprahyoid, infrahyoid thyroid, then intrathoracic thyroid. Ectopic thyroid tissue, the thyroid tissue present at abnormal sites observed in larynx, trachea, esophagus, pons, pleura and pericardium. So these are the ectopic sites where the thyroid tissue can, you can say, persist or it can do its function. Then lateral aberrant thyroid, the ectopic thyroid tissue described in relation to deep cervical lymph node. Now the remnant of the thyroglossal duct, if it persists as a swelling, we call it as thyroglossal cyst, may occur anywhere along its course. Then thyroglossal fistula opening at the foramen cecum. Carcinoma of the thyroglossal duct may happen. So you can see the communication starting from the foramen cecum and reaching to its destination. So this is the whole thyroglossal duct pathway is there. So if it persists as a swelling, we call it as cyst. If it is opening at the foramen cecum, we call it as fistula. In surgical removal of the cyst and fistula, it is important to remove all the remnants of the duct. It is to be kept in mind that duct is intimately related to the hyoid bone. So it is always advisable to remove the hyoid bone, part of hyoid bone along with that, just for the assurance that complete thyroglossal duct is removed. You can see the relation. So from the foramen cecum it is coming downward. So you can see it is going behind the hyoid bone, coming downward and reaching up to this level. In surgical removal of the cyst and fistula, it is important to remove all the remnants of the duct. It is to kept in mind that duct is intimately related with the hyoid bone. So this is very important statement. Then levator glanduli thyroidea, remnants of the duct in the form of muscular or fibrous tissue, extends from the isthmus or apex of the pyramidal lobe to hyoid bone. So this is all. This is very short lecture regarding the development of the thyroid gland. So thank you very much.